Sure, let me look you up in the system. What was your name again?
Jessica Nguyen,
Okay. And what was your date of birth?
12/6/90.
Okay. I see that your healthcare provider prescribed you a Advair discus.
Yeah, that's
Yeah, sounds good. Okay. So this is going to be for asthma control. And then if you want to come over here, I'll explain you some of the instructions. So I'll have you hold on to this for just a second. This medication is again for asthma control, and it's basically what's called a dry powder inhaler. So there's a set of dried powder blister packs inside there, and every time you open this and then press the switch and click, it's gonna pierce one of those foil packs, the blister packs. So then you're gonna take it and you're gonna not breathe out. You're gonna spit your mouth on it and quickly breathe in. So quickly inhale. Don't exhale at all because it'll just blow the powder out. And then when you're done, keep it closed. Keep it closed at all times when it's with you, and also keep it with you at all times as well. Here's some more instructions regarding that information. So I'm gonna go over this with you. So make sure that when you remove it from your mouth, when you breathe in with it, you remove it from your mouth, hold your breath for 10 seconds. Yeah, and then, or as long as possible, and then breathe out slowly after that. Throw the inhaler away after 1 month, and then, or the last time that you pierce the blister package. It will tell you on this indicator how many blister packs left inside. When it reaches 0, then it doesn't have any more inside. You can just throw it away and get a refill. So make sure that after you inhale the medication, hold it, and then exhale, that you rinse your mouth out with water. Don't swallow the water because the medication in there can still be absorbed if you swallow it, and it's not meant for your body systemically. It's just meant to be used in your lungs, so it could have some adverse effects if you swallow it. So just rinse your mouth out and then spit it out afterwards. So I'm gonna go over some storage, and then you can ask me any questions that you have. So just make sure that you store it at room temperature, away from heat and direct light. Don't freeze it, don't throw it in the fire. So protect it from extreme heat, extreme cold. Don't poke any holes into it, and throw it away 1 month after the first use. So today would be February 1st, and if you use it today, make sure you throw away by February 31st.
Oh.
And any questions so far?
I heard there's steroid component in my inhaler. I'm concerned about the side effects. I don't want it to affect my work or anything.
So it shouldn't affect your work, but there are some side effects you need to watch out for. One of them is it could cause a fast heart rate or abnormally fast heart rate. And so be on the lookout for that. That's kind of a normal side effect of this because it does contain what's called a beta agonist. It's long acting, it shouldn't cause that significant of increase, but you might feel your heart beating a little faster after it's used for a little while. You could cause what's called oral candidiasis, and so that is basically a kind of yeast infection in your mouth because the steroid suppresses your immune system in your mouth. And so, because it's going through that area, that's why it's so important to rinse with water afterwards and spit it out, because if you just let the drug sit there, then it could cause an overgrowth of what's already in your mouth. And then also it can cause headache as well, so just be aware of that, and take some Tylenol as needed. So there's some safety information I want to let you know about with this. This is definitely for asthma control. It is not for short-term symptoms, so if you're having a acute asthma attack, be sure to use your rescue inhaler, not this, because this won't do anything for an acute asthma attack. This drug is not for COPD flare-ups or status asthmaticus. If you're having trouble breathing even after using your rescue inhaler, then definitely call 911 or go to your closest ER. If you have any signs or symptoms of infections such as fever, malaise, fatigue, definitely go see your doctor to make sure it's not being caused by immunosuppression. And just be aware again that those side effects can occur where you have the fast heart rate, the oral thrush, or the headache. But in general, the steroid component of that is well tolerated at the recommended dose. So I just want to go over some realistic expectations of this. This will not help your asthma right away. It's going to take a little time to ramp up to its full ability, and it might take roughly, I would say, a few weeks for the symptoms to improve fully, because it does take time for it to ramp up. The benefits of this though is it will improve your symptoms and quality of life, and it will prevent asthma exacerbations, or at least help prevent asthma exacerbations. So I just want to talk also about the importance of adherence to the dosage schedule that the doctor prescribed to you. The way he prescribed it is that you're going to inhale 1 puff by mouth every 12 hours.
So twice a day.
Twice a day, yeah, and that will help you control your asthma. It's very important to adhere to this, because if you don't, it's going to decrease your chances of controlling your asthma. You may have an exacerbation that would land you in the emergency room. So it is definitely important, and if you do take it as prescribed, there's a high possibility that you will gain control of your symptoms, which will give you better quality of life. It's also very important that you make regular follow-ups with your healthcare provider. You're free to call us with any questions as well, and also let your provider know if the asthma is not well controlled despite you following the prescribed dosage regimen. So any other questions?
No, I think you explained everything pretty well.
All right, well, thanks for coming in. I hope you feel better.
Thank you.